to discuss with our immediate, the person who we work with, rather than feeling that it's something, a sign of weakness, if you are able to freely talk and then get some solutions as to how to deal with it, it can be. Yes, people earlier had this, but nowadays they delay. That's one more problem we face. Till I get letters from the counseling centers who work closely with the IT companies, and they would have started, done few sessions, and then they feel still the problems are not coming down, then they refer to us. Okay, so but at least there is some networking of, first way of the first point of contact of reducing it. Yes, stress is definitely there, and which can be handled at organization level, where a lot of people who are, the experienced people will come in very handy here. Okay, how they have handled the stress before, the work-life balance and all that, and there are useful lessons to learn from them.
One more question then. How do we, there is quite a possibility that a number of people, though highly stressed, may not be even showing it, or we may not be even being vocal about it. But how do we as seniors recognize those? What kind of symptoms do we look for that gives us a feeling that there is something wrong? Yeah. And when do we then get in to help them?
Sure. See, one of the things is, it's a sensitive thing if they don't discuss. But what I have observed is, what they brought it to my attention is, one, if there is a little dip in their performance, person who is consistently doing well, there is a decline in their performance. Two, absenteeism, if they are not coming to work regularly or being late. Third, if there is a suspicion of coming, under the influence of alcohol, I don't know what work practices you have. Those are the three things. Plus, they are getting a little more angry, irritable, or making mistakes in their work. Okay, where they are losing their temper. A person who is pleasant, calm, nice, and who you would like to have a tea with, but suddenly you start feeling that this man is getting really, upset or angry, then you know that there are subtle changes in his mood. Okay, maybe instead of in a group, the first step would be to talk to them and say that, look, as a person who have seen you for quite some time now, I have seen certain changes in you, and I thought I would bring it to your attention, and we don't want any serious mistake, okay, and which can jeopardize his job and all that, which we should not allow that to happen. So at the first level, it can be in a friendly way, talk about it and say that, look, if you would like to share with me, certainly you can. At the same time, if you would like to share with some professionals, I can guide you. So that much can certainly be done, which is pretty easy.
Sorry, this is not a question. Absolutely an opinion from a person who is in the professional experience. I am totally against these exams for the children. Do you think it is worth putting these children up to 8 or 10 standard? You tell them this boy is better, this girl is better, this student is better, you are getting more marks. I mean, I am asking your opinion. Do you think it is necessary to do an evaluation of children's performance to say something is better?
See, I find it hard to accept it, to believe it. Now, with respect to the examination system for children, this is something which there has been a lot of debate about it. Now, there are two ways of looking about it. One is leaving them free, what our Rishi, what is the school, which Rishi Valley School does. And there are a few other schools also who do, who till 10th standard, no exams whatsoever. So they go study under the tree, free to do whatever they like. And there are plenty of people, including from Manasa itself, I know that, who have enjoyed their studying, still be able to remember those fantastic days, and they are happy. That is okay for students who are much better disciplined. That's what I think. And in a country like ours, wherein, see, somewhere you have to bring in that competition. The reason I say is I'm not exactly for it, but the fact is whether it is job or even getting into a professional course, it's not easy. It's like a rat race. You have to work with and you have to getting into. Just giving an example, it's like about, I think, I don't know how many seats are there in medical, probably 3,000 or so, for which there will be about 2 lakh students who are studying. How do we do that? Now, can we bring in there so late? On the other hand, if there is that competitive spirit where the child learns to prepare, learns to compete, maybe accept some, to some extent learns to accept failures also, because that is also very important. Okay.
Is it necessary to drive them to you make part of the failure is also and as an acceptance, but don't put somebody on a pedestal and say this boy he is very high and he has got it, you are an idiot. So it may not be. So what I am trying to say is, yes, they should understand about competition, they should realize what it is. But I think it is too much on an young mind to say that you have failed and he has come.
No, absolutely. And that's those 3 months which we hate, really hate, because there are a lot of people, March, April, May, you have the 10th standard and the PUC exams, and every day you have somebody or the other ending life here and there, and a lot of parents who are extremely depressed. You can understand that, and we in hospitals see people taking poisons, getting admitted and all that. That's the same question which comes in, but maybe the too much of focus or the success and the failures are not accepted, and the families actually shun them away. I'm sure you would have seen in Mysore, a girl was made to beg in near a temple or so because she had, Now those are extreme cases, and the parents start seeing them as themselves as failures, rather than helping the child who has gone through a failure. And there are lots of people who have made it extremely big after, whatever failures they have seen early in their life. So there is place for competition, may not be to that extent of making them extremely stressful, but I think that is here to stay.
You said about counseling, he also said about counseling, he talked about IT. Recently I read it in the internet, 50% of the people go to psychiatrists because they are married, and other 50% go there because they are not married. So we have people of both the sets here. That I want others also to ask him if they want to.
Okay. Can I add one more thing? The people, especially the males who come to us, who are no, married men are more depressed in their life. Okay, so
I feel we because 50% we share each other.
That's what he talked about. Sharing will help. Any questions from the back side?
Whatever moment they don't feel depressed. They have a target.
See, one thing which we have to, I'll just take 1 or 2 minutes to answer that. Something which we have not recognized is that the woman by nature, her personality itself, she is much, much stronger. Okay? And psychologically it has been shown, our pain threshold and her pain threshold is very different. So she manages beautifully the home, the work and everything. Yes, they go through depression without a doubt. On the other hand, what they have is their good networking. Very rarely do you find them not talking to anybody. They would have either shared with their colleague, they would have shared with a family member or so. Okay, men sharing happens only in pubs under the influence of alcohol, which is forgotten next morning. Okay, when women make friends, clearly they stay friends all through their life. Okay, so that's very, very important. So they are much more resourceful, much more stronger, and they are, I'm sure all of us would recognize.
One aspect of the woman we want highlight is that tenacity and strength to withstand way more pressure, which is what you should be
Highlighted, sir.
Oh, sorry?
Highlighted in other secret codes.
Any more questions? Okay, thank. At the end, yes.
Actually, any doctor is associated with the organ wherein he can operate on it, or he can physically he can touch and he can feel it. But you deal with a subject wherein you can't actually, do an ultrasound scan and see there's a hole. I mean, there's a valve which is not working. How do you deal with things which you can't really touch and see?
But we do all that actually. Touch, feel, see also. No, I'm just explaining. See, one of the most important thing is, see, for a person, it amazes us, people who are coming to see us for the first time also, they feel they've come to that place where they have to bare their soul. Okay, they want to talk about everything. And that kind of inhibition is not there. So clearly we don't have to put a scan, we don't have to see what is happening. That is much more biological work. With respect to human beings, when you are talking about feelings, when you are talking about what is going on, you really don't need that kind of machines as such. Yes, you have to rely sometimes on getting information from the other sources, what is happening. But by and large, we can do that pretty effectively without having to go through all that. Maybe to some extent instinct in us also. It's like the detective, we are 1 or 2 steps a little forward, trying to analyze, trying to know what is happening also. So that bit of intuition, that bit of interest and motivation, what is required, that helps. Okay.
One more thing that he said is that we should take as a thing for whatever. Communication is always felt as something that you talk. One has to be communication. I always tell people who come to me, irrespective of the question I ask, their answer is ready. So if you were to listen, probably you have avoided or you have listen to what I am saying, you are already ready with a very small answer. I am already answered myself. I think one of the things that greatly has taken place is listening. There is a very great urgency to blurt out something and fall into a bigger pit. I think the listening is also part of the communication. I think that's one thing that we should learn from this doctor is their couch, where they put them, they talk and then to let out a lot of their own secrets. Probably he's giving him the solution also.
Just a correction, sir. We don't use the couch anymore. It's on chairs, and I get paid to listen to. So I'm okay with that. Now, many patients say that. We come here. We are not coming for advice, as he rightly said. We come here. We want to talk. We want to tell you how things are. We would like you to listen. We'll leave ourselves. So we are okay. We'll deal with it. Thank you for the opportunity.
Thank you, Dr. Madhukar, for spending your time with us. It's very enlightening to listen to you on some of the aspects, especially as a HR person, and some of the things that I go through in dealing with people. Probably given me some very good tips on how we can bring this forward. The other thing is that we are a mix of people from all ages, and as an organization, there's a lot that we have. You being the oldest in age and wisdom. So, getting all these things together for people to understand where these issues are and how is it that you are able to cope up with these kind of stresses? How is it that you can, as people, share it with buddies in the organization so that your stress levels can themselves come down? And how, as seniors, we can recognize the issues and the problems that are there and guide you through this entire thing. Thank you very much for today.